Back in Washington now, Capitol Hill is famous for holding hearings, but rarely have members of Congress been as shocked as they were today as they got the results of a new report with this startling headline. More than 10,000 veterans who went in for checkups at several Southeast VA hospitals may have been exposed to HIV or other blood diseases. Nancy Cordes has that story.
Army veteran Thomas Mayo got a colonoscopy after the VA insisted on it, only to learn it may have left him with a chronic disease.
I'm really disappointed in him.
More than 10,000 veterans have now received letters warning them that the equipment the VA used for their colonoscopies may not have been properly sterilized. So far, 6 of those veterans have tested positive for HIV, 13 for hepatitis B, and 34 for hepatitis C. Mayo is one of them.
Now I have to take the chance of losing my husband to this disease. And I don't want to lose my husband.
Investigators carried out surprise inspections at 42 VA medical centers last month and found fewer than half had properly trained the staff on how to sterilize endoscopes.
How is it possible? I can't answer that directly.
CBS medical correspondent Jonathan LaPook has performed thousands of colonoscopies.
What stops contaminated fluid from backing up into this tube is this crucial green valve. Investigators found that not only was this valve missing, but this tube was not being cleaned in between patients.
Congressman Kendrick B called for the investigation after receiving a tip from the VA hospital in Miami.
These are individuals that allowed us to salute one flag, have put it on the line for the country. The country said that we would provide health care for them if they did that.
The VA says there is no way to confirm whether infected veterans like Mayo contracted their diseases from colonoscopies or somewhere else.
This is one more event that is causing a lot of veterans to say, I'm afraid to go to my Veterans Health Center. Should they be afraid?
No, they shouldn't be afraid. In fact, they should have more confidence because the VA, as we've shown over the last decade and more, have been the first ones to report many things. So the fact
reporting a problem isn't the same as preventing it from happening.
But ignoring that it's there doesn't get it fixed at all.
The VA admitted today the problem appears to stretch back to 2003. Doctors stress this should not deter anyone from getting a colonoscopy, a procedure that saves lives.